Welcome to the Rehab Links Secrets to Success podcast. I'm Lisa Chase, your host, and today I would love to welcome Dr. Galen Wetzell. Hello,
Hello.
Galen. How are you?
I'm doing great. It's I think the 80s up here.
Wow.
A lot of people think that Minnesota is literally covered in snow 12 months out of the year, but for those listeners that may be in the deep south, we actually do get some sunshine and some warm weather from time to time. So the snow will be back in the wintertime, but right now it's actually quite delightful outside.
Awesome. Well, yeah, it's very hot here. And I have been in Minneapolis, in Minnesota, when, in the summer, and it is a nice time to be there for sure.
Well, Mark often would do a lot of classes in the wintertime,
I
and I think
know.
there were a couple that your blood was not thickened to the level that it needs to be when you come up to the Midwest.
It's so true. It's so true. But nonetheless, loved coming and learning. So, and that's actually how you and I met. I met you at a Mark Bookout course. You were assisting with teaching. I think that's kind of when we first got introduced, and I continued to come, and take those courses. And then eventually you came to Michigan State, and now you're on faculty there, and we teach the exercise course together in muscle energy. So I'm excited to kind of have you share a little bit more about your background. And you recently opened up, well, maybe it's been about a year now, right? That you've opened up your own practice. Has it quite been a year?
Yeah, that's right. So I bought this practice in the end of 2021, and for a while when I was teaching at MSU, I was pretty much the only clinical faculty that didn't own their own practice. And so, you'd kind of get that cohort together and they're like, dude, you need to break free of the corporate bonds and start your own thing. But maybe just backing up a little bit. So I worked with Mark starting in 2013. I had moved out to Oregon for a while. I was doing a residency program out there, orthopedic residency. And then I moved back and just had the outrageous fortune to be able to work with Mark. So Kyle, Kyle Cook, he and I continue to teach some of Mark's courses. I actually took over for him. And so we've remained good friends and good colleagues. So I was able to slide into that, and Mark became a mentor of mine for many years until he retired. And if people haven't listened to your tribute to him, it is a fantastic one. There certainly were tears and of laughter and tears of joy with that. So you just did a fantastic job with that. So if people haven't listened to that, I certainly would encourage them to do that. But he was really my introduction, as you said, to you and then to everybody at Michigan State. So again, we can, I'm sure, tell some stories about him, maybe when we were riding in the car to the airport and that sort of thing. You might remember that one. We can tell at some
I
point.
do
But
remember
yeah.
the panic set in. Oh God. Well, and so now talk a little bit about Bookhout Seminars, right? Because you own your own clinical practice where you're seeing mostly like orthopedic, and are you doing some chronic pain as well?
Yeah, I would say all of that and then kind of weird stuff too. So, one of the things that Mark had talked about, and I think all of us as clinicians learn, is the better we get, the harder and weirder stuff we see. And
Yeah.
so there certainly is a cohort of that comes my way. I know that you see as well, and we'll find Carl and Lisa DiStefano and the people that have been around for a while start to get, again, the stuff that other people can't figure out. So I started teaching, assisting, as you talked about when you and I had first met each other, maybe 2016, 2017, something like that.
Yeah.
And then as Mark sort of phased out of teaching, I had the great privilege. I mean, really, it is an honor to be able to continue to teach those courses under his tutelage. He would read the course reviews like a hawk, and be able to give some feedback about how to manage time and that sort of thing. And I think, just as a little bit of an aside, but the first time that I ever taught at Michigan State, I was teaching with you and Mark in the exercise class,
Yeah.
and Mark threw me a bone with this, what should be a pretty straightforward section of upper quarter, or maybe it was lower body
Your
neural tension,
attention.
something like that. And I think that section is slated to last about 90 minutes, I'm pretty sure. When I stopped counting, I'm pretty sure it was like past the 3.5 hour mark or something like that. And I remember walking back after I had finished, and neither you or Mark really said anything. You just kind of gave me one of these, and sorry for those listening, but just kind of a look. And I was like, all right, we've got some things to work on. So one of the things that was so great about Mark is obviously he was a fantastic clinician, but he was a good teacher. And those are two different skill sets. And a lot of people don't appreciate that. And people can be really good clinicians and not be good teachers. And quite frankly, when we all think back to PT school, we probably had some good teachers that maybe weren't that great of clinicians. So to have that combination made for a really good mentor in Mark, and a really good example to be able to follow. So Kyle and I continue to teach his courses. I think we have about 10 different courses or something all throughout the body, extremities, spine related stuff, headaches related stuff, into the fascial world. And one of the classes that I hope to add maybe next year or the year after is one that integrates a lot of breath work as well. That's something that I do a lot of. So it continues to be a great privilege to do this. And I know that he wanted us to continue to teach this work because he spent his life developing this and refining it and really packaging it. And one of the nice things about the courses at Bookhout Seminars is you don't have to become a purist in any of this stuff. And there are certain modalities, I'm sure that you've taken before, certain clinical concepts where you have to be a purist in that. And this approach that he's developed really is a wide net that you're able to cast and be inclusive for lots of different things. So if you're a Maitland-based therapist, you can add some different things from the courses that we teach. You don't have to totally change. You can start to just broaden what you do. Let's say if it's a course on an extremity or the low back or something like that. So I remember when I took my first course from him, I left very overwhelmed. In fact, it was during the first course, I was talking to him maybe in a break, and I just said, "Yeah, this is a lot of new stuff." And he just said to me, "Come Monday, when you start seeing people, you don't have to completely change what you do. Just start to add things back in slowly, little by little, and your results and your ability to work through problems will be one of the things that helps you to be able to integrate this work better." So, of course, I'm biased, but I think that it's from a learning perspective and from a clinician development perspective, I think it's just a really, really helpful way to approach learning new skills, because we all want to continue to learn. I know you continue to take a lot of classes. You've got a new technique and a new approach every time I see you. So I'm always picking your brain about that stuff, Lisa. And it was the same way with Mark, and it's the same way that I try and model my practice after as well.
Well, I think those are all really good points. One, I would say the Bookhout, seminars, which I've taken most of those courses, and the Michigan State, I think give you a great framework to spring off of and build onto, right? So I think that is always super, helpful, and you can, because I've had lots of different, like you said, I've learned all these different things, but I always come back to the foundation. And I think that that is really critical. And the other thing is, I think to get really good at a skill, you have to repeat Like I always say, rinse and repeat. Like I just teaching the muscle energy, I've literally rinsed and repeated that course over and over and over again. And every time I learn something new. And in order to really master and get good at a skill, I think that finding a model that you really jive with and diving deep into that and maybe taking those courses over and over again helps you really get a better appreciation. I think as a younger clinician, at least I know I did this, I took a lot of courses, right? But then as I found the Michigan State model and worked closer with Mark, I really started to hone in on just taking those or teaching those to get and refine my skill, which I think, then helps us get better clinical outcomes.
Yeah, I think that's a really good point. I was teaching, I won't mention the clinic, but I was teaching at a clinic I was doing a low back and pelvic class in, we'll say, November. And then I was going to come back. I did come back in January, and I taught a thoracic spine and rib class. And I thought, well, great, this is a pretty sharp group, and I'm going to build in some review stuff during the second class, the thoracic spine and rib cage class. And I I thought they were pretty straightforward questions about, oh, can you tell me about the behavior of this type of sacral diagnosis, relate how we might relate that to certain things. And it was crickets. It was like I had never been there and I had never taught at all. So I'm really coming to appreciate that it's almost a skill to be able to integrate new skills. And there are better and worse ways to be able to do that. But if a person just passively goes to a course with the expectation that they're just going to absorb something via osmosis, it's not going to happen. And more often than not, if you don't have a mentor, if you don't have a way to be able to follow up and refine your techniques, they don't necessarily work. They don't feel the same as, Sunday afternoon, that last time that you did that. It's like, oh, everything's clicking and it makes sense. You go back on Monday and it's like, holy buckets, I don't remember. I don't know where to start. I don't know what to do. So you just go back to what's comfortable.
Yes.
So one of the things I think with the rehab links that you do, don't you have a mentoring, like
Yes.
a deal that you can do? Can you talk a little bit about that? I remember when you had approached it, and it just seems like such a really good opportunity for people.
Yeah, it's after you've taken the exercise class and you've learned the principles, you can not only take some of the online, coursework, which is a lot of what we teach in the actual hands-on course, so you can be referencing it, but then we can also do mentorship. So, whether it's a one-on-one call like this, where we're brainstorming, now you're back in the clinic and you're like, oh, I've tried, that prone technique with the hip mobilization, and I'm struggling with, XYZ, or, how have you found this to be most effective? Whatever it is, then, we can use that as an opportunity, to just further accelerate and try to implement what we're learning. Because, like I said, most people, like you were saying, they go to a class, they take it, they may get 10% of it, but they don't really fully integrate it. And the only way to really integrate it is to take the class over and over, or you have online tools or mentors where you are just constantly, asking those questions, having a study group, having some way of learning. And I think you hit it on the head. It's like a whole another like way of thinking about learning compared to like when we were in school, right? We're just like learning a bunch of stuff to get to an endpoint. But to really master a skill and get good at it, it's like you got to put a lot of work into it. I remember Ed used to always say, Dr. Ed Isaacs, he said, you can teach a lot of people how to play the piano, but only a few people make a living at it. And I feel like it's the same thing with manual medicine and with what we do. You can teach a lot of people how to do it, but there's only a few that are really going to do the work and put in the hours to get good at it.
Yeah, I think that's good. I recently just listened to a Huberman Lab podcast about growth mindset, and one of the things I wasn't really familiar with that terminology before, but one of the things that he talks about as far as growth mindset versus a fixed mindset is this idea of being comfortable with struggle.
Mm,
If you can be comfortable with not necessarily being super crisp with what you're doing, but willing to struggle and work through it and endeavor, and kind of those awkward moments. Maybe you have to bring your book into the room with you and you're not quite sure of how to name this or that. If you think of that from an identity perspective of, oh, I'm a great PT, I should not have to do this, maybe you're going to be less likely to do that. And ultimately, long term, you're going to be stunting your growth and what you can be as a PT, versus if you have more of a growth mindset and you are willing to be in that struggle, in that difficult time period when you're still refining skills and trying things out, and think of that as, oh, this is hard. That means I'm getting better. That means I'm growing in what I'm doing. And you don't sort of look at it from an ego perspective. So I've been thinking about that a lot this week and been sharing that with some patients as well. But that gets to everything that we're talking about. If you really want to get good at this, at this craft, at this art, again, it doesn't matter what you do. You can be great, a great Maitland therapist, McKenzie, muscle energy, myofascial. You can be really, really good and help a lot of people at all those things, but you have to be willing to go through some struggle to be good at it.
yeah, I mean, you said it perfectly. It's very, very true. You gotta be uncomfortable. I remember when I learned how to dry needle, it was just the skill. I use my hands all the time, but the skill of using a needle versus like your hands was a whole different skill, and the feel of what the needle feels like and feeling a muscle twitch, and it was uncomfortable because it was something like you're fumbling around, you're trying to figure it out. Even when I first started on the pro women's tour, I was having to like do things that I had never done before, and it was extremely uncomfortable after 10 years of feeling like a skilled clinician. And then you feel like you're like, what am I doing? But, the more you can get uncomfortable, the more you grow. So I love that. All right, so let's jump into some tips, because I know you get great clinical outcomes and you've worked over the years of refining your skill. So what would you say that you could share, with our audience, that you think your top 3 tips are of how to get better clinical outcomes?
Sure. Number one, I would say know your anatomy. And if there is one constancy between all the best clinicians that I've ever been around who do things wildly differently. So this isn't all just Michigan State based or muscle energy based. I remember working with a guy by the name of Joe Godges. He was a professor and a PT out at USC in California, when I studied in Oregon. And, the professors that teach in the Barral Institute, everybody at Michigan State, Mark, Carl. I mean, really, it was Carl's knowledge of anatomy that
Yes.
was the open door for the rest of us. Had he not had that knowledge, we may not be here and the program at Michigan State may not be what it was. But it's that knowledge that I think allows a person a greater sense of possibility with what they're doing, not just when you're thinking about coming up with a diagnosis, but also in the moment. And there's a great quote. I think I've got the book in here. It's a cranial book, um, by a last name Geehan, and I won't get the quote exactly right. So sorry if there are people out there that are big Geehan fans, and you can correct me. But I'm not on Twitter, so you won't be able to find me on that. But he essentially talks about, in the beginning, we learn these techniques, but it's our knowledge of anatomy that allows us to be present to the needs of the patient in that particular moment. If
Yeah.
you don't have an understanding of the anatomy, you can't start to make changes. A great example, for those folks that have had the muscle energy work, is Carl Steele came up with a modification to one of the CT junction techniques, muscle energy techniques using the longest coli. He figured that out based on his knowledge of where this stuff attached. He's come up with some other things, similarly, first rib, second rib stuff,
Yeah.
based on his knowledge of anatomy. So these were things that came to him decades into his practice. But it
Sure.
was that foundation or that knowledge of anatomy that allowed him to do those things. So, again, regardless of what a person specializes in or what really makes sense to them from a methodology standpoint, or they can feel really well in their hands, having a sense of anatomical knowledge about what's underneath your hands, I think really just makes your job that much easier.
Yeah, so true. And yeah, Carl and Mark, really brought that to light for sure. So that's your first tip.
Yeah, number one. Number two, I would say take your time getting to the right depth of where you need to be. So I remember when I was early watching Mark perform and work with his patients, I'd be shadowing off to the side, kind of trying to peek in and seeing what he's doing with his hands. And a lot of the stuff I didn't know. And he was doing visceral stuff and cranial stuff, and I had no background in that. So I didn't understand what he was doing with his hands. But there were some things that I had a sense eventually of what he was trying to get to as far as structures and that sort of thing. And I remember thinking on multiple occasions as he's sinking to this right depth, boy, he's taking longer than I would have taken. Like I was more of the mindset of, okay, I got to get to the thing. Let me just go right at it. So I'm going to put my hands or my thumbs or whatever to where I need to be. But he would take his time. And so I think that skill in and of itself can make everything better that you do. Another great example that we'll talk about in some of our coursework when we're doing fascial work for the thorax, for example, you can start to gain depth to different structures without necessarily having to use heavier pressure with your hands. And it sounds like a paradox. And when I was early in my work with this stuff, it didn't make sense to me. Like, how do you mean you can gain depth without adding pressure with your hands? But that's where some of the art and the skill comes in, and one of the things that we really trying to hone in. So when you are a new clinician, or even if you've been working for a while, really try and be as precise as you can with whatever you happen to be palpating, because it's going to make that technique, whatever it is, that much more successful for you. And you're not going to have to use as much force. That's the other thing with it. If you can be precise, it makes everything that much easier. Again, I'll go back to example with Carl Steele. If you ever watch him do manipulation, it's so it's a flick. It's just this little bit because he's taken the time to refine exactly where he needs to be, and then it's just the littlest bit of an impulse, and he can make that technique work. Versus people who I observe who do a lot of manipulations, they're like getting hands behind the head and they're cranking and they're doing all these big movements, and they're not precise at all.
Yeah.
And I know Mark did, and I as well. I bristle at the idea that one should strive for general techniques. I think the more specific you can be to what the biomechanical fault is, the less force you're going to have to use and the less risk that you're going to make somebody sore as well. So being as precise as possible, sinking to the right depth, I think those are really important skills to do, to be able to have in your toolbox.
Yeah, those are, I know in the foundational course of principles of muscle or principles of manual medicine and in muscle energy, the palpation skill is the key, the localization and how you're palpating, to feel exactly where you're at is really key, because otherwise, you're oftentimes blowing, past the barrier if you're too hard, or palpating with too much force, you're not going to be able to feel anything. So I think that is those are very good tips. Okay,
Sure.
so you have number 3.
I do have a number three. It was hard to narrow it down as I've
Yeah.
been thinking about top three things. But I think what I would say is pay attention to the breath. And this is going to lead both to information that you can get about your patient, but also information about yourself as well. So, for example, if I'm working with somebody that has neck pain, jaw pain, headaches, I'm amazed how many times they come in and they're breathing with their shoulders moving up and down. They're having a lot of tension in through their SCM as they're breathing. Their breathing is shallow. Well, if that's the case, there's going to be very little that I can probably do from a hands-on perspective or even from an exercise perspective that's going to be able to overcome that dysfunctional breathing pattern. You and I are probably going to breathe somewhere on the order of about 20,000 times today, maybe a little bit more, maybe a little bit less. And if each of those breaths adds just a little bit of extra muscle activation that's going to pull the head forward or adding excessive tone in the scalenes, you're forever going to be battling first ribs coming up and you're going to be forever battling dysfunction in the CT junction. So, understanding when you need to also teach somebody how to breathe in a different manner. And first things first, I will often teach people how to breathe in just a quiet and relaxed way that involves using their diaphragm in an appropriate way. And we can talk more specifics about that if you're interested. But then I also think it's really, really important and a different ball game to teach somebody how to breathe when their core is activated.
Mhm.
And that's they're not the same.
Yeah.
And I'm kind of astonished how many people come and see me who have been through Pilates and yoga and various core exercise routines, and they can't breathe well. They're either holding their breath or they're taking shallow breaths when they're trying to be able to hold their core strong. And guess what? If you can't breathe well, you are sacrificing a lot of core strength. There is no two ways about it. It has a big role and influence on pelvic health dysfunction or lack of dysfunction if a person can breathe well. So making sure that a person can breathe in a biomechanically congruent way to what they should be doing, I think is a really helpful tool that I had been missing for a lot of years. And I certainly am more aware of it now. And then lastly, just about the breath, I think when we can check in on our own breath, it gives us a clue to where we're at as far as are we present with this person? Are we getting agitated or annoyed with this person? Am I calm? Am I present? And there's a book that I read by a guy by the name of Mark Devine. He read a book called or wrote a book called Unbeatable Mind. He was a former Navy SEAL, and he was telling this story about he got called into his superior's office. He had done something, but it wasn't really his fault. But long story short, is he's getting chewed out by this guy that he doesn't really care for. He kind of doesn't respect him as much. And as he's telling this story in the book, he talked about how he could feel his uh, kind of anxiety and anger rising at this guy just going at him. But he had the self awareness to be able to check in on his breath, to check in on his emotions. And what he was able to do right then and there in that moment is start to change his emotions by first changing his breath. So
Mhm.
he was able to start calming his breath down and get to a place that he was now sending signals to his nervous system that he was not under threat. He wasn't about to fight this guy. And so he could be in a more parasympathetic place rather than a fight and flight place. And he could be much more in tune to really the root of his emotions, of why he was getting angry, and be more responsive to what that superior officer was saying, because not all of it was probably unjustified. But if you come at it with a lens that you're defensive and you're not going to listen, then you miss out on that. So I think, again, from my perspective, when I'm working clinically, if I can check in on my breath and I can be in a place that I want to be from an energetic standpoint, from a standpoint of being present, then I know that I'm going to be the best that I can possibly be with that person. If I'm getting anxious, if I'm getting tense, if for whatever reason my body is in a fight or flight state, I'm not going to be as responsive, and I'm certainly not going to be as effective, I don't think, for the patient in that moment.
I think that's a great point, and I think breath is critical and very tied into the health of the nervous system. And when people come in and they're in pain and they have, say, for example, a low heart rate variability, poor breathing, they're in that high sympathetic load, it's very hard to get them out of pain. And so, working and focusing on the breath, I use a device called Heart Math, which is really a biofeedback, right? That helps you tap into your own heart rate variability and then use breath or what you're thinking to change your breath pattern and your heart rate variability and calm the nervous system. And I'll use that with quite a few of my patients. And I use it myself because, like you said, as a clinician, and especially as an entrepreneur, business owner, and clinician, you're wearing multiple hats and your brain might be in multiple things, and you really want to try to be present, when you're in with patients, and having something like that, a good breath practice or some kind of biofeedback that helps just kind of bring you back to center. I think that's a great point.
Yeah, one of the things I like to do with the heart math as well is, you get them hooked up, you get them looking at the screen, and you get them to a place where they're pretty coherent and they're in the green. And then what I'll do is I'll have them start thinking of something that frustrates them. So
Yes.
choose your political person that just riles you up. And it is amazing, by not changing the cadence of the breath,
Yep.
not changing anything other than their emotions, how
Yep.
you can see their coherence tank. And
Absolutely.
it's often a great example because people are like, wow, my thoughts matter.
Yeah.
How, if I'm frustrated, if I'm angry, that's going to change how well my body is able to heal, or whether I'm going to be able to be calm with my kid or whatever it happens to be. So yeah, heart math is a great tool for that.
Yeah, excellent. Well, those were great tips. Now, I know, you do a lot of teaching, and is there anything specific to you and what you teach that your audience particularly appreciates that you could share?
Yeah, I will often close with this, and I certainly don't mean it to come off as egotistical because I haven't taught anything. Nobody knows who I am if they don't know me from a course or anything. But I would say that I've gotten to a pretty accomplished level as a PT, but there's nothing special about me. I wasn't born with any superhuman ability to palpate. I had My memory's not that great. I got really lucky because I had a really, really good mentor,
Mhm.
but I've also worked hard.
Mhm.
So I've developed some strategies over the years to put in extra reps, put in extra work to try and get better at what I do. But where I am now is not a reflection of, something that anybody else can achieve, because I think we sometimes see some of these great clinicians and we just think, I can't do that. I'm never going to be there. I'll never be to that level. And
Right.
I do think some people are born with certain abilities that other people don't have.
Mhm.
But if we're looking at the middle part of the bell curve, where most of us are, there are things that we can do to make ourselves better, but it takes work. It
Yeah.
takes effort. And when you do take classes, you have to be intentional about trying to integrate that information. And if you sincerely want to get better at your craft and what you do and have more enjoyment throughout the course of your workday, you need to put in that extra work, but let go of this idea of, holding people up on unachievable pedestals. There's no reason that you or I or the next person can't also get to a great place where they can help a lot of people and they can feel really good about what they do.
Yeah, that's so true. I remember when I first started working with Mark, I was just like, ooh, like those are going to be big shoes to fill, right? You know, he was quoting all this research, and Carl Steele too, you know, you watch him finesse through a body and you're just like, God, how does he do that? And probably the best compliment that I ever got is I treated one of his patients and I'm going through my exam and she stopped me and she turned around and she goes, wow. She goes, Carl really did teach you. She goes, I thought Carl was actually here in the room. And I was like, you know what? That's the best compliment because
That
I
is,
have
yeah.
tried to emulate, right, him and Mark and, you know, all the different mentors that I've had, but particularly them, you know, their skills, you know, equally as high, but very different, right, in their approach. And so, yeah, it's just putting in the reps, like you said, and being willing to do that. So, so true. Well, this has just been so great to talk with you and to have you share your insight and to see how much you've grown and changed since I first met you. And is there anything else of value that you'd like to offer the listeners if they maybe might be interested in coming to a Bookhout seminar course?
Yeah, so Kyle and I think he was on a podcast earlier, and what we'd like to extend is any class that Bookout Seminars is hosting, we'd like to have offer the opportunity to have $100 off the course. Usually they're 3-day courses, and we're planning on doing one probably in 2024. So it's a great opportunity to get in and start to have a sense of the structure, the format of what we've discussed today, as far as courses and what you and Kyle talked about as well. So all you got to do is reference the Secrets to Success podcast, and you're automatically linked in with that $100 off.
Well, I would highly, highly recommend that that the listeners look into Bookout Seminars. We will have several of the links, right, of how to get in touch with you and the Bookout Seminars in our show notes. If they want to directly, maybe you can just tell them the best website that they can go to, and then I'll also have that in the show notes.
Sure. So if people are looking to take courses or learn more about Bookout Seminars, learn more about even Mark, so we've got some information about him because there's probably some people listening to this that keep hearing about this Mark guy and are like, who the heck was this guy? So we've got some background information about him on there. So that's bookoutseminars.com. And I think it's bookoutseminars at Gmail. If people have questions about things or are looking to host a course, we travel all throughout the country, and then a lot of courses, obviously, just regionally here. If people are interested in finding me or getting a hold of me, I practice in the Minneapolis area out of Minnesota. So if people are in the area and they want to either have some treatment or learn a little bit more about my practice, Creekside Physical Therapy is the name of the practice. And our website is creeksidept.net. And on that website, there's a place or a little portal where you can send me a note and we'll get back to you. That all comes to me and I can triage it as need be. And we get back to people pretty quickly about that.
Excellent. Well, thank you so much for your time. I certainly appreciate it. And until next time, keep getting great outcomes.
Thanks, Lisa.
Thanks.